Hey everyone, so I wanted to make a video talking a bit more about the experience and preparation involved in those F.A.P screening tests I had done. And the first one is the endoscopy and sigmoidoscopy, which examine the upper and lower parts of your digestive tract and involve sticking a scope through your mouth and then through your rectum. And this would be something I'd suggest talking to the GI doctor who's performing your scopes beforehand, and that's what types of scopes to use, because my research has shown that for people with F.A.P, it's more beneficial to have a side view endoscopy for looking at the duodenum, and then a flat viewing endoscopy for the stomach. And then there's actually some research that suggests that a capsule endoscopy, which I believe is swallowing a camera, is beneficial for looking at the jejunum in people with F.A.P. So yeah, it's just something to consider talking to your doctors about. And then as far as preparation goes, as it does involve undergoing anesthesia, at midnight on the day of your surgery, you have to stop eating, or not surgery, your procedure, sorry, you have to stop eating or drinking. And then the good news is that you don't have to do the traditional prep work that a person who is having a colonoscopy has to do. So you don't have to drink those 2 gallons of laxatives, which is great. But you're not totally off the hook, as you do have to do these enemas, which are basically bottles of saline, and you insert the tip into your rectum and squeeze all of the solution out into your body, and that just sort of helps flush you out, and it is a laxative, so that means you'll probably be spending the next half hour on the toilet, but it's really not that bad, and you have to do one the night before your exam and then the morning of. And although they're unpleasant, I'd really much prefer them to drinking all of those laxatives. So yeah, and then once you get there, they'll insert an IV, and once you get in the room, they'll pretty much inject the anesthesia, and that's sort of that. I believe my procedure lasted about a half hour, and you're probably familiar with what that sort of feeling that accompanies low doses of anesthesia, you know, that sort of grogginess and tiredness, so you might want to take a nap afterwards. But other than that, it's, you know, relatively painless. And then there's the CT with contrast of the abdomen and pelvis, and that's to examine if there are desmoid tumors or any abdominal cancers such as pancreatic or adrenal cancers. And I did just want to put this out there that a lot of the more recent research on F.A.P screening seems to suggest that it might be beneficial to have an MRE, which is basically an MRI of your small intestine. And based on, you know, what that picks up and the fact that it doesn't use radiation, it sort of seems like that might be a better route. And after talking to my GI doctor, I think that's what I'm going to have done instead of the CT with contrast next year. So that might be something to consider. But anyway, back to the CAT scan. So prep work for that, basically 4 hours before you get there, you can't eat anything and you can only drink clear liquids. And you usually have to get there about an hour and a half ahead of time, just because you have to drink that barium, which is gross. And then after you drink the barium, you usually have to wait around for an hour for that sort of to go through you. And I will give you guys a little insider tip. The past few times that I've had a CAT scan with contrast, I've only been able to drink one of the cans of barium. And they've usually told me that that's fine, and we've been able to get clear pictures and everything. So if you, like me, have trouble drinking all of the barium, that might be something to ask the hospital staff about. But anyway, once you get into the room with the CAT scan, they hook you up to an IV so that they can inject the dye, and I believe the CAT scan takes about 10 minutes. And the only other painful part of all this is when they inject the dye, that can sort of cause a sort of warm sensation throughout your body. It might make you feel like you need to pee. And for me, it also sort of burned the back of my hand and caused it to twitch a bit, so, but that's problem sort of went away right after the CAT scan. So, yep, that's the CAT scan with contrast. And then there's the thyroid ultrasound, which is basically to detect if there's any cancerous activity in the thyroid. and that involves getting some warm, sticky gel sprayed all over your neck, and the tech will rub a tool all over your neck and ask you to tilt your head up and turn your head different ways so that they can get the thyroid from different angles. And it lasts about 15 minutes, which isn't long in the grand scheme of things, but when you're lying back having someone, basically touching your neck, it sort of feels a lot longer than it is. And for me especially, it was pretty nerve-wracking just because, every time that they'd take a picture and spend a bit longer on taking one picture, I'd start worrying that there was something wrong or something. But they have to take pictures, and they have to take a lot of pictures, so just because they're taking all these pictures doesn't necessarily mean that there is something wrong, so don't immediately freak out. But yeah, it's pretty painless as well. And yeah, and then the last test that I mentioned was the basic eye exam, which isn't probably what you immediately think of an eye exam. It's not, cover your eye and read from a chart, although that might be part of your eye exam, I don't know. It's more when the ophthalmologist comes and looks more deeply at your eye with special light and special magnifying lenses and things, just so she can more deeply examine different parts of your eye. And that's for the CHRPEs, or those bear claw lesions, just to see if there's anything going on with them. And as far as prep work goes with that, there's really not much, except when you show up at the doctor's office, they'll give you those eye drops that'll dilate your eyes, which feels a little funky, but their effect wears off after a few hours, so it's not really a big deal. But yeah, those are all of the F.A.P screening tests that I've had, and I would say you're welcome to email me if you have questions about any of them, but I would actually advise that you talk to your doctor first, because they'll probably be able to give you a bit more thorough of an answer. So yeah, alright, I'll talk to you later.